Welcome to my show. A guest here. Her name is Brooke Bralove. Mrs. Brooke, how are you doing, ma?
I'm great. Tammy, how are you?
I'm fine. Thank you very much, Mrs. Brooke. Firstly, you are a physiotherapist. You are also a licensed clinical social worker and a mother accelerated resolution therapy. Can you please, Mrs. Brooke, discuss more about yourself and how you are doing currently now, Mrs. Brooke?
Okay, sure. Yes, I'm a psychotherapist. I've been in private practice just outside of Washington, D.C. for 21 years. And I work with adults, couples, groups, and we work on issues like depression, anxiety, trauma, relationship issues. I'm also an ASEX certified sex therapist, and I also am a certified Daring Way facilitator. So I do some of Brene Brown's shame resilience curriculum in kind of a group workshop format.
That's very, very beautiful. Thank you so much, Mrs. Brooke, for those beautiful insights. And I would like to also dive to your book from the experience you've had as a physiotherapist and other activities you are doing. Have you written any book under that, or are you planning to write any book in the coming future, Mrs. Brooke?
So I've had a book in my mind for about 15 years, and I've got an entire envelope, with about, I don't know, probably 50 or 60 post-its. So one of these days that will be a book.
Oh, definitely. We'll definitely be expecting that it's definitely be a very wonderful one. Thank you so much for those insights, Mrs. Brooke. I would like to dive to the ART, which is the Accelerated Resolution Therapy. We do know that there are a lot of therapy. Have hundreds of therapy like that, different type. But there's also one called the Accelerated Resolution Therapy. Can you please tell us what Accelerated Resolution Therapy is, and how do you personally think it's differ from other trauma focused therapy like MDR or CBT, Mrs.
Mhm.
Brooke?
Yeah, so accelerated resolution therapy is also called ART or ART. I call it ART. And ART is an evidence-based treatment modality that uses rapid eye movement and something called voluntary image replacement to change the way the brain stores traumatic images and sensations and the corresponding negative sensations or the way one gets triggered in the body. And art is very brief. It usually only requires 1 to 5 sessions. And it actually does come out of EMDR. So I like to refer to art as EMDR on steroids. And it is different from EMDR in certain ways. And I'm happy to go into those ways so people kind of understand because EMDR is more well known. It's been around a little bit longer. Art was developed in 2017 by a wonderful therapist, Lainey Rosenzweig, who actually attended an EMDR training and felt like something was missing. So it's different from EMDR in that in EMDR, you focus on uh, kind of thoughts and feelings. With art, we focus simply on images and sensations. That's kind of what we work to change. And it is also much briefer. So, art is usually 1 to 5 sessions. EMDR can be usually 10 to 20. Also, with art, we use a very prescribed amount of, eye movements. And what makes art is the eye movements. EMDR, you can use any other sort of bilateral stimulation, but with art, we really try to start with the eye movements. Now, if someone is truly unable to do eye movements, we can, move to bilateral tapping, but it really is all about the eye. The research shows that the eye movements are far superior in efficacy.
That shows that EMDR, that's where the ARC really came out, but it definitely differs in the way it really works when it comes to therapy and also healing the body emotionally, things that triggers the body. Thank you so much for those insights, Mrs. Brooke. And I would like to dive to areas. Do you think there are some type of issues or diagnoses that respond best to the ART, maybe like PTSD, anxiety, or depression? Do you think there's any type of issues that you think it responds to the most, Mrs. Brooke?
Yeah. So, I used to say, if you'd asked me this 5 years ago, I would have said, yeah, trauma, PTSD, and I would have stopped there. But the number of issues one or diagnoses one can come in with and have art be effective for is literally infinity. And I truly mean that. So, yes, it's built and sold as a trauma therapy, but it works on relational trauma, so complex PTSD, emotional abuse, sexual assault, phobias, addiction, OCD, certainly depression and anxiety, eating disorders, insomnia, ADHD, and then even things like chronic pain, chronic illness, or even coping. So, for instance, someone might come in and say, I hate co parenting with my, ex husband. And we can help them learn to become more neutral and less bothered or less triggered by that co parenting interaction, body image issues, even if you feel unmotivated to do something, like if you would like to be more productive at work, we can work on that. Performance anxiety, any kind of performance anxiety related to sports or work, public speaking. I mean, it is literally limitless. So anything that you would go to a therapist for now, I believe we can also help and address with art, and it's much faster and more effective.
That is very beautiful. That means those type of situation like the depression and all those areas, PTSD, trauma and suicide, all those things can definitely be, work on when it comes to the ART. Thank you so much for those insights, Mrs. Brooke. And I also like to ask, there could be certain individual, I do not know, there could be certain individual that you feel or people think ART might not be really effective for. Probably people who are maybe truly more in a very high rate of depression and stuff like that. So, do you think there are certain individuals you think ART does might not be effective for, or it's effective for every single person, Mrs. Brooke?
So it's a great question, and I certainly find that it's effective for most people. There are a couple caveats to that. So if someone has an active seizure disorder that might be triggered by bilateral eye movements, I would have them check with their neurologist first before doing art. And anyone with like an active concussion or something, migraines are fine. Actually, art can treat migraines pretty effectively, so that's fine. And then, really, the only people that art will not work for are people that are not motivated to change. So, this is not a treatment that you bring a screaming adolescent to because it won't work. They don't want it to work and they're not going to participate. So, it does require, it doesn't mean you have to believe it'll work or believe in the therapy. You don't. You can be a complete skeptic. I love when people come in and they are totally skeptical and it works anyway. But you do have to be wanting to change whatever aspect you're working on that day.
I completely agree. When the mind is not there, when the motivation is not there, when the trigger is not there, what will work? Nothing will work, honestly speaking. So they have to
Yeah.
be the motivation. They have to be the urge that I have to. This thing has to work with this ART I'm going for. This accelerated resolution therapy I'm going for. I definitely want to see change. I definitely that energy and that motivation has to be there. So it will definitely also, honestly speaking, it can't be everybody's work, but those who are ready to definitely work for them. Thank you so much for those insights, Mrs. Brooke. And I also like to ask, if the ART can also be combined. I've heard you say that it's totally different from other type of therapy. It deals with the emotion trigger stuff like that. But do you think it's often combined with other therapeutic approaches, or do you think it's just a standalone treatment throughout, Mrs. Brooke?
Yeah. So I would say it's both. So certainly there are people who come in and they'll say, I was in a car accident, 3 months ago, and I have not been able to drive since. And in the, intake, we'll assess that that's the only reason they're there. So we will simply do art, and that will be that. And frankly, that usually can be knocked out in 1 to 2 art sessions. But there are other people where I certainly will combine psychotherapy. So we might do an art session, which leads us to want to explore more issues from childhood. And then the person might want to do some psychotherapy and kind of alternate. And then I also have people who are in long-term psychotherapy with me, and then I'll suggest art for very specific things along the way. Or I'll say, we've been stuck around this one issue. How about we try art? But I do think it's important that within art, we do utilize kind of other strategies. So, internal family systems work, we'll talk about different parts that are showing up in the art process, or gestalt work, talking to a younger self and trying to work with that younger self in the past to bring them kind of forward into the future. So, we do weave in other modalities, mindfulness, certainly, when you're kind of tracking sensations, that's a mindfulness practice, and visualizations, imagery, things like that.
Thank you so much for the insight, Mrs. Bro. That means it's also depend on the type of person. Also, you also depend on how the person brought in their approach. That is when someone will definitely know if the ART can definitely work throughout, or if there are also therapeutic areas that we could definitely put into to also help the person along the way. Thank you so much for that insight, Mrs. Bro. And also, Mrs. Brooke, I would like to also dive to the point of, a new person, as people that, might have not got into the ART before, that once you really get into it, I myself also want to, but those people that you feel like, they might just want to get into it. So, what do you think a typical accelerated resolution therapy session look like for a new client, Mrs. Brooke?
Mhm. So I always do a 60-minute intake. And again, art can be done virtually or in person, and it is equally effective, truly, truly equal results. But so I always do a 60-minute intake, and that is, why are they here? What are they motivated to work on? And then I'll figure out history, but not, every single thing in their lives, because they're there usually for something brief and a little bit more specific. So we'll do an intake, and then in the intake, I explain the entire art protocol. So art is a protocol, and that's another way it differs from EMDR. EMDR can be a little bit more meandering. Art has, a beginning, a middle, and an end, and we call it accelerated resolution therapy because there is truly a resolution at the end of every session. So I will take them through the protocol, exactly what's going to happen, describe it, answer any questions. And then their a typical art session is about 90 minutes. Occasionally, someone will get through it in 60 or 75 minutes, but I always leave 90 minutes because it's a more relaxed pace. I don't want to be rushing people just to get it in under 60 minutes or something. So I give them 90 minutes. And a typical art session really requires sort of a check in the beginning about how one is. Let's say somebody is coming in because they're having, they have a spider phobia or something. We'll ask them how they feel about that, and then we'll rate the intensity of those feelings. So they might say they feel anxious, scared, frustrated, defeated, something like that. And we'll rate the intensity of those feelings at the beginning of the session with something called an artometer. And at the end of the session, we do the same thing. And so the idea there is we can really measure how successful that session was because you should have immediate results. So, our goal is to get you down to a 0. And if someone is terrified of spiders and they're thinking about spiders at the beginning of the session, they may be at an 8 or a 9. And the goal is to bring them down to a 0. Does that happen every single session? No, I can't guarantee that, but it really does happen often. And then we just lead them through the protocol. And so often a second session will be even more effective because that person will understand, oh, that's when we do this part, or that's when we do the positization. And then they can predict. And there's a real cadence to art. So I say a lot of the same prompts. And so people, again, the brain loves predictability and pattern. And so what I think is so beautiful about art is that it just provides that within the protocol.
Thank you so much for those insights. Definitely, that shows that the ART definitely work with step. It's work the protocol. It works with the time, but definitely it's not usually follow the time. One has to just definitely dive to the person, understand the person, and know how one can definitely penetrate, and also know how one can definitely solve the situation the person is bringing to the table. So those steps are definitely important in the ART, that's as a resolution therapy, so that that person would definitely be able to be assisted in the right and the proper way. That is very beautiful. Thank you so much for that insight, Mrs. Brooke. And also, Mrs. Brooke, there's a question I normally ask during the end of the show. From the forefathers, there are a lot of beautiful things that do exist during our forefathers' time that is missing in our time today. If there is anyone or anything you would like to bring back to our time today, Mrs. Brooke, what do you think that thing will be, Mrs. Brooke?
Empathy, 100% empathy. I think we're truly, truly lacking empathy for the other. And I think that everyone has a story. And, there's a saying, you can't hate people up close. And I think that's really true. So if we put aside differences, and we start chatting with someone on a park bench, that is how we build empathy with other people, is by bringing curiosity rather than judgment to our interactions and to, how we understand people. And I truly, truly believe that if empathy, how to actually be empathic, which is a skill, if that were taught, in schools, I think we would have people who are different in the world and who really can have this sense of, if I were to put myself in someone else's shoes, if I were to feel that same feeling, not necessarily know their experience, right? So if you've lost your father and I haven't, I don't actually know what that feels like, but I do know grief and I can pull it from my own life and then imagine how you might feel. And that builds bridges. And you cannot hate people up close, but it means you got to interact with them first.
Yeah, I completely agree with you, Mrs. Brooke. Definitely, in this time of this time that we're a very busy world, we're in a very busy time where everybody wants to be busy, and definitely there are a lot of things. And this empathy that you are saying, to have this type of sense of empathy, one definitely have to have community. So want to have communication with one another. One of physical communication. No, that will show the kind of empathy and love and care with someone that have with each other. I think we are really lacking that currently. It's not easy, and we hope that it definitely come back, because if that is not there in a long term, I don't think it will really benefit our health or benefit every single person. I have to be honest with you, because the people that are currently ruling now, who are currently doing things now, during that time they really experienced it. Now that we are not experiencing, the ones that are coming next, I do not know how it's going to look like, because we have to have the sense of empathy and love and also care within each other. We have to also understand that we have to just have the sense of love, and everything that could come in one way to make someone to be better in the life we've come for. We are all coming in this world. We are in this world now. Tomorrow we might not be anymore, and that is just how this world is. We come and we go. I want to sincerely thank you for this time and the opportunity you've given me, Mrs. Brooke, on speaking on the ART, which is the Accelerated Resolution Therapy, the ways and how the therapy definitely works. Thank you so much, Mrs. Brooke.
Thank you, Tammy.
All right, so have a wonderful day, Mrs. Brooke. Bye bye.
Okay, thanks.